After years of wondering what can be done to address the opioid epidemic in the Ozarks, one man, the keynote speaker at an opioid conference held by Bureau Behavioral Health, says he's got an idea on where to start. Our Colin Lingo has this story.
Yeah, from local emergency responders to even the director of Health and Senior Services for the state of Missouri. Today, people in that room heard from a gambit of people dealing with this opioid crisis from a unique perspective.
Because the person doesn't want or can't get the other.
Attendees sat from 9 to 5, essentially an entire workday, listening and having discussions about how this problem can be addressed in our community. The keynote speaker, Dr. Omar Manijwala, literally wrote the book on the psychology of cravings and addictions. We got to speak with him a little bit earlier. He said the answer to fixing the opioid crisis isn't fewer prescriptions, it's fixing the underlying problems.
I mean, we have to really go after the drivers, the causes of this crisis, which really relate to a crisis of untreated depression, untreated anxiety, trauma, post-traumatic stress disorder, and untreated addiction. So, if we try to restrict the drugs, we've seen this before, where, it could be heroin, it could be opioids, at times it's been alcohol and other things, and anytime we try to restrict one thing, another thing pops up.
And what it's going to take is
the fundamental question I'm going to talk about today is, what if it were easier to get help than it were to get high?
Now, to be clear, this is not a conference looking to eliminate the use of opioids altogether, because Dr. Manijwala maintains there's still a healthy use for pain-killing drugs, specifically for patients who might have a chronic pain issue. Instead, this conference is looking to bring awareness to an addiction problem that claims tens of thousands of American lives every year. Colin Lingo, Ozarks First.